Today's video we're talking about cervical stenosis and chronic neck issues. Now I know a lot of us are working from home and on our computers, and we have a lot of neck issues that keep coming up, and it all starts with our posture.
Now, cervical stenosis is also called degenerative joint disease or osteoarthritis, and really what it is just the bones are starting to degenerate, just exactly in the words. And this is caused over a long period of time as we get older, and the longer we have that bad anterior head forward carriage, the longer it's going to start to form this. Now, imagine, if you will, holding a bowling ball out in your hand. Now, how long do you think you can just hold it out there just like this? In reality, your head actually weighs as much as a bowling ball. So, this is a normal curve in the neck. Whenever we have cervical stenosis or DJD, we have a neck posture kind of like this. Whenever it's like this, this whole head here is trying to hold itself up all the way out and forward. So your spine is trying to support it, just like a hand trying to hold a bowling ball out there. This is normal. So when this happens, we start to form what's called osteophytes or bone spurs right on the front of the disc.
So what we call is anterior head carriage is whenever your head starts going forward. And usually by around 4 inches, you get up to 42 pounds of pressure on those discs, especially those ones that are right at the bottom of your neck. So how does this happen, and how do poor posture happen? It results from poor habits. Everything that we do, we're looking down. There's our cell phones, we're constantly looking down. Our laptops, driving, just about any type of action requires you to have your head looking down. And this is what really contributes to that anterior head carriage as we get older. Here what we're looking at is a typical sign of cervical stenosis. Notice that these little bitty bony protrusions called bone spurs or osteophytes start to make that entire disc look like a boot and start to flatten out. When that happens, the little spart between the discs starts to narrow, and then the little cartilage that's between it starts to squish. When it squishes, it starts to affect right here. That's called the IVF, the intervertebral foramina, and that is usually where the nerves and everything come from. This is a normal neck. See the nice, big, fat disc space, and then the bony parts that look like nice, plump marshmallows? That is usually how it's supposed to look. And this right here is a nice long curve that's directly in front of your head, and this happens because the body isn't trying to hold itself up all the time. So, with cervical stenosis, it's not a problem of not having a good curve in your neck. Like here, that's a good curve. It's the fact that it's too forward. So in order to draw it back, this extension and flexion is only going to take this head carriage and go up and down. What we got to do is find a way to bring it back, such as just like this. So flexion and extension exercises with cervical stenosis only makes it hurt and doesn't help actually get your posture back to where it needs to be. Now, many patients that I see that have this issue gradually start to have symptoms that come along with it, with that forward head carriage and those nerves being choked off. Now, many patients that I see that have this issue gradually start to have symptoms that come along with it, with that forward head carriage and those nerves being choked off with that radiating pain, that pain that goes in the back here and into the neck. So with our head being carried forward so much, it just starts to affect the blood supply to the brain and to many of the muscles around the neck and to the eyes. So eye fatigue, muscle fatigue, jaw issues are secondary issues that definitely come from bad posture. Something that also I've noticed a lot in a lot of patients that come in is difficulty with breathing, such as what we call a subluxation of the rib head. Whenever one side pops off and it looks like you just can't turn your head to the left, that could be definitely due to having the neck in such a forward position. So as the chest contracts and expands, the lungs go up and down naturally. And with that, doing that, what's called the thoracic outlet is already closed off because your head isn't all the way back to where it needs to be.
Now I want to show you guys some exercises that can help your posture and help build some neck muscles to help fix cervical stenosis. Now, the first set of exercises are really simple, and it's called a chin tuck. Now, typically, what we're trying to do is take our chin and just make a double chin. Just like that. And there's a few ways we can do this.
Now, the chin tuck exercise is designed to strengthen the deep cervical muscles. With this movement, we'll be strengthening the muscles like the SCM, the scalenes, the levator scapula, and the semispinalis capitis. And it's usually done in 3 different stages. We're going to do the chin tuck prone. We're going to do it either seated or standing next to a wall, or we'll be doing it laying on our back supine.
So the seated version of the chin tuck is really simple. All you gotta do, take your finger, put it on your chin, and push your neck back. Make a double chin, and hold it there for about 3 seconds. Do that about 2 to 3 times.
In addition to doing the seated chin tuck, we could also further it by putting a ball, like a soft ball, like a bouncy ball, behind your head on a wall, and doing that exact same motion by pushing the ball back and holding it for about 2 to 3 seconds. Now this is the prone chin tuck, and this is definitely helps with your trapezius muscles and the splenius capitis muscles. So I want you to just tuck your chin in, hold it in place just like that for about 3 to 4 seconds. Make sure you just keep that position, keep those muscles taut, and do that about 2, 3, maybe 4 times. Again, making sure your chin stays tucked. This is the supine chin tuck. Basically, you can put a towel or anything behind you just to be able to push down and make a double chin. Hold it there for about 2 to 3 seconds, come back up, and just repeat the process. And this is definitely good for the SCM, the levator scapula, and the scalene muscles. Helps strengthening them. Now this next exercise is called isometric head holds. Basically what you're going to do is you're going to look over your shoulder and up as you keep your head level, and hold it there for about 10 to 15 seconds. Bring it up, go to the next side, look over your shoulder, and if you wanted to, you can put some pressure on your head, pushing it down slightly just to give you a little resistance, and that can also be a next step that you could do if you feel like you grew up to it. Now this next exercise is called crocodile breathing. Basically it is a push-up, but you're using your shoulders and you're just decompressing and compressing them, moving them anterior and posterior. So how you want to do it, you can either do a full push-up, bring it down, and then come back up. What we're just doing is we're just moving our shoulders, not our arms. Or we can do the assisted push-up. And this helps with the scalenes and the rhomboids and the teres major all in the back. And that's not in the neck, but it definitely helps with bringing that posture again back to neutral position. Now this next exercise is more of a stretch, and it's called the chair grab. This is to help stretch out the scalenes and definitely help out stretch out the traps. And what it's going to do is lower the shoulder as we bend our ear to our next opposite shoulder, and a gentle tug like so. So grab the table. You're going to try to pull there as you try to stretch this way. Nothing too hard, just enough to feel a little bit of a stretch right there in your shoulder area, right in this area.
Alright guys, that is it. Thank you so much for watching. Please hit the subscribe button down below if you haven't already done so. And if you'd like, please leave a positive comment. And until next time, stay healthy and stay active.